We are seeing lot of questions in Google about blood vomiting, lot of answers to be known by many people. I am Dr. Somasekhar Rao, Senior Consultant Gastroenterologist and Hepatologist, Yashoda Hospital, High-Tech City, Hyderabad. Today, we will answer few of the questions which have been coming up about blood vomiting. Here is the first question. Is blood vomiting a serious condition? Why does it happen? Yes, blood vomiting is definitely a serious condition. All of us should be aware of this. Blood vomiting is obviously, as it says in the name, someone who vomits blood. It is blood vomiting. It can also present in another way. Your stool can be black in color, and this is called melena. This can also be a presentation of blood vomiting. So blood vomiting can be means there is bleeding happening anywhere from the upper gastrointestinal tract, your esophagus, your stomach, and it can be in the small intestine and to the right side of the large intestine also. So this can present most importantly as black color stool, and if the bleeding happens in the upper gastrointestinal tract, that is in the food pipe or in the stomach or in the first part of the duodenum, that is the first part of small intestine, this can present as blood vomiting. Let's go to the next question. What are the types of bleeds you encounter commonly? So upper gastrointestinal can be broadly divided into two types. First one, we call it as a variceal bleed. The second thing would be non-variceal bleed, if I divide them broadly. So in portal hypertension, what do I mean by portal hypertension? The blood vessel which supplies blood to the liver is called portal vein, and there is excessive pressure in patients with cirrhosis of liver. This portal pressure transmits back into the veins or blood vessels in the food pipe and the stomach, and we see swollen blood vessels, and sometimes they rupture and cause massive blood vomiting, which can be a life-threatening condition. This is variceal bleed. The other one I would classify and tell it as non-variceal bleed, and most of us know about this. This is nothing but ulcer bleeds. So you must have heard about ulcers. Ulcers can be in the upper gastrointestinal system, it can be in the esophagus or food pipe, it can be inside your stomach or in the duodenum. So these ulcers can cause bleeding or blood vomiting. So left untreated, this can be a life-threatening issue. So we need to address them very early. Let's go to the next question here. What should be done immediately if anyone has blood vomiting? Yeah, this is very important question actually. Anyone who has blood vomiting, if they see blood when they vomit, it is an acute emergency. You need to attend an emergency room immediately, because blood vomiting can cause a life-threatening issue. Sometimes there can be something called syncopial attack. That means people can faint because of blood vomiting, because there will be low blood pressure. Suddenly there will be drop of blood pressure, and people can have dizziness and syncopial attack, or there can be loss of consciousness transiently. And if the blood pressure is low for prolonged period of time, it can cause problems to other organs in the body. So it should be addressed immediately. If anyone has blood vomiting, attend your emergency room. Immediately at the emergency room, your vitals will be monitored. Most importantly, your pulse and blood pressures. If the blood pressure is low, then you will have to be administered either IV fluids or sometimes blood if the bleeding is massive. So this is very important, and these are the basic steps of resuscitation in anybody. So if you see a black color stool early in the morning, this is an acute emergency. You need to attend an emergency room immediately. Generally what we tend to do is to assess a patient whether it is variceal bleed or a non-variceal bleed. And initial treatment starts in the emergency room after resuscitation. We may start you on some injections. If it is a non-variceal bleed or an ulcer bleed, we will start you on an injection called proton pump inhibitors, and we will start you on IV fluids. If it is a variceal bleed, someone has a background of liver disease, or if they have any signs of liver disease, we will start them on an injection called terlipressin or somatostatin, which decreases the pressure on the varices and decreases the chances of rebleeding. So these are the immediate steps which should be taken if someone has blood vomiting. So be very careful, be very attentive, and attend an emergency room immediately if you observe blood in your vomitus or if you observe black color motion. These are very important things to be noted. Next, I have a very interesting question here. How effectively can we treat blood vomiting? What are the treatment modalities? This is very important, and all of you should be knowing about this. How do we treat blood vomiting? Most important, ABCs is the basic thing for any treatment. ABCs is your airway, your breathing and circulation. So first and foremost thing what we need to do is to pay attention to all three things. These are the most important things. So once your airway and breathing and circulation are secured, that means you need to be in emergency room once you have blood vomiting, and when all these things are good. So this is when we assess your status, your hemoglobin. If the hemoglobin is above 8, we tend to do the further testing called, most important testing for blood vomiting is an upper gastrointestinal endoscopy. We call it as gastroscopy, and gastroscopy is nothing but with a camera we check your food pipe, your stomach and the duodenum. This is a very effective tool in diagnosing the reason, the cause for your upper gastrointestinal bleeding. So once we do an endoscopy, we will be able to identify the cause. We will be able to differentiate with 100% confidence whether this is a variceal bleed or a non-variceal bleed, source of bleed, from which point the bleeding is happening. All those things can be localized. And most important thing and useful thing in endoscopy is we are not just diagnosing, we will be able to treat upper gastrointestinal bleed with endoscopy. So it's not just a diagnostic modality, it's a therapeutic modality. So generally when we identify the source of bleed, we based on the type of bleeding, if it is an ulcer bleed, we have multiple modalities of treatment. Most important is an adrenaline injection which is done around the bleeding blood vessel or the ulcer from where the bleeding is happening. We have some other therapeutic instruments when we do endoscopy like hemoclips. Hemoclip is nothing but we will be suturing the blood vessel. Like that we will be holding the blood vessel with a clip and we will be able to stop the bleeding. This is for non-variceal bleed or an ulcer bleed. And if it is a variceal bleed, as we were talking with the background of liver disease, we will be identifying the blood vessels in the food pipe called esophageal varices, where we can do esophageal banding on the same endoscopy sitting and we will be able to control the bleeding. So these are the different modalities, and there are various advancements in the treatment of upper gastrointestinal bleeding by endoscopy. So all those things can be done effectively. So the next question here is, what is the success rate of endoscopy in treating blood vomiting? Yeah, very relevant question related to the previous question actually. We were talking about different modalities of endoscopies and treatment of upper gastrointestinal bleeding or blood vomiting, and the success rate of endoscopy is up to 90 to 95%. Most of the time we will be able to control the bleed in an endoscopy in 90 to 95% of cases. So success rate, I would say 90 to 95% for an endoscopic therapy of upper gastrointestinal bleeding or control of upper gastrointestinal bleeding by endoscopy. So we have more questions actually. So upper gastrointestinal bleeding or blood vomiting is actually a trending topic. I think there are more questions coming up. I didn't expect these many questions on Google about this topic actually. So let's go to the next question here. What other modalities of treatment are used to control bleeding if endoscopy fails? Very nice question actually. So we were talking about the success rate of endoscopy in the previous question. It was around 90 to 95. Yeah, obviously endoscopy fails in 5 to 10%. That is the question here. And if endoscopy fails, most important, now we have advanced treatments. Next doctor who comes in would be an intervention radiologist. So we have many treatments in the bucket. If the endoscopy fails, the first and foremost thing what we try and do is to observe a patient for at least 24 hours after first endoscopy. If we feel the endoscopy has failed or if the patient rebleeds, that is the whole issue. The patient rebleeds after the first endoscopy. A second endoscopy is attempted after 24 hours. Only if the second endoscopy fails, then we will resort to other modalities of treatment. Most important thing here is a intervention radiologist. So if I feel it is a variceal bleed and endoscopy has failed, then we have a procedure called TIPS. We call this as rescue TIPS. Rescue TIPS is we will be decreasing the pressure in the portal vein. I was talking about increased pressures in the portal vein, which has caused swelling of blood vessels, and rupture of those blood vessels cause bleeding. So if we can decrease the pressure in this portal vein, and that is by a procedure called TIPS. This is done by an intervention radiologist, and sometimes we may have to do this procedure as an emergency, and we call it as rescue TIPS. Other modality for non-variceal bleed or ulcer bleed is angioembolization. So through the angiogram, we identify the bleeding vessel here, and then when we identify the bleeding vessel by an angiogram, we will do some coiling and block the blood vessel which is bleeding actually. This is called angioembolization, and when you combine endoscopy and your intervention, radiological interventions, the success rate of clearing or treating a upper gastrointestinal bleed would be around 98%. So previous days, we were doing a lot of surgeries to stop upper gastrointestinal bleeding or blood vomiting, but now the percentage of requirement of surgery has come down to less than 2% with these modalities like endoscopy and intervention radiology. So very interesting questions. I have one more question coming up actually. This looks very relevant. What is the first most important treatment to be done at a primary or secondary care treatment levels before reaching a tertiary or quaternary care in cases of blood vomiting? Apt question here actually. The most important thing at any primary care center is to address the ABCs. Again, I would say airway, breathing and circulation. Your vitals should be checked properly. Your BP, pulse should be less than 100. Blood pressure should be more than 100/60. These are basic things which needs to be addressed at a primary care center. If at all the BP is low or the pulse is very, very high, they need to be given blood transfusions immediately before going in for a endoscopy. So always massive upper gastrointestinal bleeding is an acute emergency. You need to be treated in a tertiary care center, but before coming to a tertiary care center, initial address your ABCs, get yourself IV fluids and simple basic investigations, and if at all there is massive bleeding, you may require blood transfusion immediately before coming or reaching a tertiary care center. These are the few things which we need to address, but most important, wherever you are, if there is blood in your vomitus or if there is black color stool, it is an acute emergency. You need medical attention immediately. This is baseline what I would like to emphasize. Yeah, it's a very nice interacting, and this is what Google asks and Yashoda answers. Thank you.